My name is Isiaka Shehu, a student of JPTS International Institute of Management Science and Technology in collaboration with Global Wealth University, Lome, Togo, and Pan American University, California, USA, a 300-level public health department student. I'm to present a brief term paper on topic attitude, knowledge, and perception of healthcare worker on transmission and prevention of COVID-19. Coronavirus is the most recently discovered viruses that have caused a new disease called COVID-19. The COVID-19 pandemic began in Wuhan, China in late 2019 and continued to spread across the globe, which was declared pandemic by WHO in February 2020. These diseases spread via cough, respiratory droplets, contact with bodily guides, contaminated surfaces. Health-related infections are major problems of public health in many nations of the world, which ultimately cause an increase in the morbidity, mortality, and additional cost in healthcare settings. Healthcare workers are facing an elevated risk of exposure to infectious disease, including the novel coronavirus, COVID-19, in all countries. Preserving the health of healthcare workers has now become one of the main concerns of all countries affected by the coronavirus. Maintaining the health of the hospital workers, especially the medical staff, required knowledge and awareness followed by proper behavior for disease prevention and transmission. The purpose of this study is to evaluate the knowledge, attitude, and behavior of healthcare workers towards patients with suspected or confirmed COVID-19. The study shows that 99% of health workers were aware regarding the ways of transmitting the diseases COVID-19, such as close contact with patients with suspected coronavirus. It further shows that about 76.4% respondents, which are health workers, said patients with suspected coronavirus or even patients infected by the coronavirus needed hospitalization. 99% of the participants, which are health workers, also knows that patients with underlying disease who become infected by the virus or die of the virus. About 93.3% were well aware that people with mild symptoms could transmit the disease during the incubation period. And 85% of healthcare workers knew that antibiotics used will not affect the prevention and treatment of coronavirus. It also shows that 14% of health workers were unaware of the coronavirus symptoms. Understanding the knowledge, attitude, and perceptions of health care workers on transmission and prevention of COVID-19 is essential to bring forth a sustained change in behavior of individual and institution to improve such practice when such practice is designing interventions. This is the reason why healthcare workers and governments are clamoring for hand hygiene. This can be achieved by frequent washing of hands and the use of hand sanitizer, either in the public place, in the market, in the hospital, in any place at all, to prevent disease transmission of COVID-19. Thank you.